the Dentrix booth at ODA ASM 2018. We're talking with Sue Mason. Sue, you are a CDA, EDDH, and certified adult educator. And I understand you're very involved in running the business side of the practice. So perhaps we can start with you sharing with us how Dentrix helps you in that daily running of the business side.
Well, I love Dentrix so much for the ease in entering provider schedules. With multiple doctors and hygienists in a practice, I can easily and quickly enter what their schedules are for the entire year, include their holidays, any days off, any changes to their schedule on a daily basis with just a couple clicks. Also, Dentrix is so wonderful in that regardless of what area of the program you're in, it auto-documents any information and treatment from the back to the front. So whether you're working as a clinician or as an administrator, you're able to find patients' information so easily right at your fingertips.
And have you noticed any increase in productivity or profitability with using the Dentrix system?
Oh, absolutely. The unscheduled treatment lists and the continuing care lists in Dentrix are so easy to use. So having key people on your team utilizing those lists on a daily basis and getting those patients scheduled sooner than later is reducing the downtime in your schedule and obviously increasing the productivity at the end of the day.
Perhaps you can share with us a little bit more detail on the actual reports that you're pulling. Let's start with some of the reports that you're pulling on a daily basis.
On a daily basis, we start with the morning huddle report. It's a great report that summarizes all the information that you would want at that morning strategy meeting. Any outstanding hygiene, any outstanding treatment for a patient, alerts about a patient that you would need, any undocumented patient information, and it's all summarized onto one report rather than having to dig individually into every single patient's chart to find that information. And that's customizable per provider that would be wanting to find the specific information that they want.
And what about when we're looking at the reports that you're pulling on a monthly basis?
Month end is done very simple and quickly. The provider total report is a report that shows you exactly how much the doctors have made in a month, and then you can figure out how much each of your providers is to be paid at the end of the month. The referred by report is a report I love to pull every month to see where the new patients are coming from. And from a marketing standpoint, whatever your practice does for thanking for your referrals, you can follow up with that quick report. And then the practice advisor report is a summary of all the practice KPIs or key performance indicators summarized all together. It allows you to set your own goals and benchmarks so that you can celebrate your practice successes.
We all know, and there's certainly been a lot of discussion about dental offices being busy versus dental offices being productive. So perhaps you can share with us in your own words what the experiences you've had about being productive versus being busy.
Being busy is just everyone running around, filling the holes in the schedule so there's no white space, and multiple patients coming in throughout the whole day. Ultimately at the end of the day, you really haven't produced a lot of money. But being productive is taking a strategic and proactive approach to it. Utilizing Dentrix Perfect Day Schedule, you can customize every provider's schedule to perform the procedures at the time of day that they prefer to do those procedures. As well, it allows you to save time in the schedule for patients to move forward with treatment that they've accepted. There's nothing worse when a patient says that they want to go ahead with treatment and then you can't get them into the schedule for 3 or 4 months. So the Perfect Day Scheduler is the easiest way to just quickly, with a few clicks, save all of those appointments during the day. So ultimately, being strategic increases your productivity and more so decreases your stress level throughout the day.
There's a goal to aim for.
Yes.
So for any of our viewers who are considering or looking at a new practice management software system, what advice would you give them?
I would look for a product that is totally seamless from clinical area right through to the administration area. Look for a company that's been around, that's got a lot of history. Look at what their support system is. Can you get a human on the phone very quickly when you're having trouble in the practice versus leaving a message and someone will get back to you at their convenience? Also take a look at what the real nuts and bolts are of the practice. There's a lot of programs out there that the graphics are very appealing. However, there's really not a lot of meat and potatoes behind that. So I would suggest making a list of all the things that you would ideally like the program to do, and then evaluate the softwares out there and see if they actually can do what you're looking for.